Hi, folks. We're going to give it a minute or two for everyone to settle in, but we are happy that you're joining us today. Would love if you take a moment just to introduce yourselves in the chat. We will have a chance to hear from all of you in a little group discussion and then throughout the session, but it's nice for folks to see who else is in the room. So once you're settled in, yes, welcome, welcome. Feel free to introduce yourselves. Again, we'll give it just a minute or so. Want to be mindful of the various time zones and also folks having busy days with back-to-back activities. Thanks, Connie, for kicking us off in introducing. Also, folks, if you want to look at the drop-down menu, you have the option of sharing messages with the host and panelists or with everyone. It's great if you want to share with everyone. I think the default might be host and panelists. Great, thanks for those who are starting to introduce themselves. We are going to get started just for the sake of time, but please do continue to share in the chat. Want to give an official hello and welcome to this webinar session focused on planning ahead for extreme weather and environmental impacts on aging. My name is Arielle Mather, and I'm the program manager of the National Center for Equitable Care for Elders. We have a really wonderful session today with a fantastic subject matter expert and a community health center that's going to share about their programming. So I'm really excited that you're all here with us. Go ahead to the next slide. These are all very straightforward. We are all pretty familiar with Zoom now, but please note that everyone is muted to prevent any background noise. We'd love to hear from you in the chat or the Q&A feature. We are recording this session and we'll make a point that everyone who registers, not just everyone who is here live today, will get the recording and the slide deck for your reference. And as always, we'll have a chance right at the end of the hour for you to fill out a brief survey. We'd love to hear your feedback. It helps us to shape future learning opportunities. If you are not already familiar with our center, I want to prioritize our speakers' time today. So just a quick note that we do have a variety of training and technical assistance offerings, all focused on the health and well-being of community-dwelling older adults. We encourage you to stay in touch with us. We're heading into the summer, which means a few less live activities, but we have an e-learning library with some modules that you can learn at your own pace and lots of recorded webinars and publications if you'd like to take a look. All right, great. So I am going to let our speaker introduce himself further, but I want to kick off today's session just acknowledging that our subject matter expert, Dr. Peter Maramaldi, is very busy, as you can see on this slide, teaching and instructing at several universities in Boston. We are so grateful for his work with us as a social work behavioral scientist. He works with physicians, nurses, health economists, and caregivers to talk about effective models of interprofessional healthcare to older adults living in the community. And so he's going to walk us through some content initially today. Feel free to, again, put your questions or comments in the chat, and then we'll hear from our health center speakers and then go into a nice discussion to round out the hour. So Peter, I will hand it over to you.
Thank you very much, Arielle. And I want to thank the staff for the National Center for Equitable Care for Elders, Tiffany, Juliet, and Arielle, as well as our PI, Dr. Christine Reedy. It's a wonderful group to work with. If you haven't already, I would direct you to their website. It's rich with resources. Can we do the next slide, please, Arielle? This is the learning climate. And basically, I would love this to be as inclusive as possible and that everyone feels comfortable and welcomed here. And if I get it wrong, please tell me. And next slide, please. And I mean that sincerely. Arielle's going to give you some instructions. You can start looking at this QR code, but I just want to say that some of the content today may be disturbing to folks, and I just want to forewarn you that we're going to be talking about disasters and older people. All right, great. So I am going to kick off today's session just acknowledging that our subject matter expert, Dr. Peter Maramaldi, is very busy, as you can see on this slide, teaching and instructing at several universities in Boston. We are so grateful for his work with us as a social work behavioral scientist. He works with physicians, nurses, health economists, and caregivers to talk about effective models of interprofessional healthcare to older adults living in the community. And so he's going to walk us through some content initially today. Feel free to, again, put your questions or comments in the chat, and then we'll hear from our health center speakers and then go into a nice discussion to round out the hour. So Peter, I will hand it over to you.
Thank you for that, Peter. You can see on the screen that we're going to use Mentimeter just for a few moments as our speakers are kind of preparing their materials, just to get a sense of who is in the room. Thank you for all of those who are introducing yourselves in the chat. There is a QR code that you can use to get on Mentimeter on your phone, or you can go to your browser to menti.com and use the code 53956401. You can also feel free, as Tiff is saying in the chat, to put things in the chat box if Mentimeter is not your preferred platform of choice. I know sometimes it can give folks a little bit of a hard time. So there'll be just a few questions to, again, do a little level setting with our group. I see some of the thumbs up in the corner coming. Thank you for that. So again, you have a few options in how to join. We'll go ahead to our first question. Some of you are sharing your locations in the chat. It's nice to have a quick visual. All you need to do is click on the map. Sometimes Mentimeter doesn't give you quite the accuracy. You know, we can't quite zoom into all of the various spots on the map, but we get a general sense of the distribution today. Again, you can put it in the chat. Oh, thank you. We have some international representation today as well. Fantastic. Thanks for those who are putting their dots on a map as well as sharing in the chat. Great. I do think this is a particularly interesting question when we're thinking about emergency preparedness, especially for extreme weather. There's such variation across the country and territories that I would love for you to continue to share through this hour some of the unique concerns or strengths from your areas. Thank you all for sharing. Let's go ahead to the next slide. We're going to attempt a little word cloud. So this is a long question that really just needs a very short answer. So in a few words, think about your own organization's biggest challenge in preparing for environmental impacts on the older adults in your community. So this is thinking about biggest challenge. There could be many, there could be one in your mind. Again, responses will build. You'll see, yes, we'll start to build a word cloud. So the more that something is inputted, you know, the larger it will get. As you can see, housing is getting bigger, accessibility is getting bigger. So just think about barriers for your organization or your area. Again, using the chat is totally fine as well. Seeing a lot of things that we have resources spelled out, but a lot of these things do kind of point back to resources, funding, capacity, staff, but then things like, as I see in the chat, SDOH needs. So that you see on the word cloud: transportation, communication, access to resources, absolutely. Housing. Yeah, I see someone acknowledging racism. Certainly there can be some pretty deep challenges in trying to effectively prepare this population. Caregiver support, yes, thank you so much for acknowledging that. Wonderful. Well, I know it's not necessarily a happy question, but I think it's so enlightening to hear, or to see rather, some of the things that you are encountering, and hopefully can help normalize that for others. And yes, thank you, Cheryl, in the chat. Ageism, absolutely. Let's go just to our last prompt so we can prioritize. Again, Dr. Maramaldi's presentation and hearing from our health center. This is a scaled question where you can drag your answer along a 1 to 5 scale, starting with strongly disagree, ending with strongly agree. So there are 2 statements. This is just about your own opinion on your organization's place right now or capacity. You'll see that we'll get an average as responses come in. So the first statement is, my organization is adequately prepared to respond to the needs of older adults during the next extreme weather event. So that would be for your location. And the second statement is, my organization has access to emergency preparedness resources for staff to use with older patients. So you can see even the little distribution behind the actual average. A lot of folks are right there in the middle. It tapers off at the very top, a little bit on the very bottom. for the second statement. So I think it gives us a good sense of there are certainly resources and preparedness represented here, but there's room to grow, there's room to reflect, and hopefully tap into some additional supports to make us feel more confident in that. All right, great. Well, I appreciate everyone sharing. Continue, please, to put your thoughts and feedback in the chat and the Q&A, and we'll circle back to that towards the end of the hour for discussion. Thanks so much.
Thank you, Ariel. And I want to say it's really, I'm so happy and honored that the folks from the Hawaiian Island Community Health Centers are willing to join us today at 7 a.m. Hawaiian time. So welcome to them. And I'll try to keep my remarks brief so that we can get through everybody. I'd like you to tell me in the chat if you're not seeing this visually, if you're just doing if you're just listening to it, if you're just doing the audio, because I'm not going to read everything on the slides, but I'll read more of the content otherwise. And next slide, please, Ariel. I've reviewed the registrations very closely, and it's clear to me that you all understand about the aging population. And we know that the aging population is increasing in the United States. There's a population shift due mostly to decreased fertility rates, as you can see on the graph on the left. And we saw the mortality adjustment rates. There's the beep there, unfortunately, for COVID, where we saw mortality rise. But we see that people are living longer. And thanks very much. Next slide, please, Ariel, to the wonderful resources that we're able to provide to folks. This is an interesting slide. If you look at this, the way to read this is it's a ratio, and the x-axis are years. And if you follow that green line, if the green line represents the number of people under 65 in the US population. And you can see that relative to the people who are 65, you can see that in the 50s, there were much more, we were a younger society. But you see how old we're getting? And the line just before 2004, this is a very recent projection between now and 2054. We see that's going to continue. So there's more older folks than younger folks. Now, this is from the CBO, Congressional Budget Office, and what they're concerned about, next slide, who's going to pay Social Security? Who's going to pay into the Social Security for all those folks? I just want to take a moment and say that if you don't have the visuals, please just put in the chat. I don't have the visuals, but this is a very interesting slide from NASA. And if it's an interactive, you can go to this later. I've designed this slide deck, this section of the slide deck for you to reference after the fact. But the Earth Systems Observatory, and you can read here the types of climate change, extreme weather that's being observed globally. And what I find interesting here, the things you would expect, droughts, wildfires, heat extremes, but heavy precipitation. Yeah, there's high tide flooding, and we know that a lot of old people live near the water now by choice, and that exposes them to high tide flooding and their property and their livelihoods and their survival. But floods we would expect, but heavy precipitation. We just saw this recently in Houston. Next slide, please. And there's something to consider. So here's the FEMA definition of national disaster. Take a look at this. If anything's missing, why don't you just stick it in the chat, and we'll send it off to the feds and see if they can include this in this definition. What's important about FEMA is that it's the way that a lot of resources get distributed. Not the only way, but a major way that resources get distributed after a natural disaster. And a lot of this is dependent upon who's sitting in the White House and what they consider a national disaster. Next slide, please, Ariel. So how do these environmental disasters impact older adults? Obviously psychological distress. We're going to talk a little bit more about that, but it's something to be considered. Social isolation is really important. NCECE has done quite a bit of work with social isolation. There's a new emerging literature on social isolation. It's pretty common knowledge now that an older adult who is socially isolated or lonely, it has the same effect on mortality as smoking 15 cigarettes a day. That's pretty dramatic. The Surgeon General declared this an epidemic in the United States prior to COVID. After COVID, people were aware of it. But think about how natural disasters impact social isolation. If comms are down, if communications go down. What if I'm 85 years old and I live in a rural area and my neighbor was really my lifeline and a tornado takes their house and they move away, what happens to me? Who knows I'm there? Who's going to take care of me? Who's going to come in and look after me? Not only that, but in the face of a disaster, the kinds of social networks that people come to depend upon get very disrupted. Older people, increased risk of injury and mortality. I mean, we get brittle when we get old. If you think about it, if a 40-year-old falls down, it's very different than if an 80-year-old falls down. Maybe you've seen footage of a first responder carrying an elderly person on their back. Think about how painful that might be for the person on their joints and being pulled out that way. We don't think that way, but they're more prone to injury and, of course, mortality. This idea of exposure to pathogens is important, and this is related in large part to heat and flooding. If you think about heat, how many people live in a region where there used to be a frost and now there's not a frost? What happens? Bacteria grow that in the past would have died. Those bacteria may have ill effects. Vector-borne diseases. Maybe there's not a kill-off of mosquitoes or other carriers or animals who carry disease because of the warming climate. And some of the resources I'm going to give you, they have excellent multi-language public service announcements and charts to talk about water safety after a catastrophic event. Is it safe to drink the water? I mean, not everybody can afford to go out or has access to bottled water. I mean, just things like that, this increased risk to pathogens, which will affect people with compromised immune systems much more dramatically than it would affect the general population. And I'm going to talk more about PTSD, but it's clear, I mean, this literature is there's a lot of observations, a lot of surveillance that people, older adults, are about 2 times more likely to experience PTSD than younger populations following a disaster. Next slide, please. And please, in the chat, if you have anything, put it in there. This is a recent report, January 24. I would direct those of you, and again, I reviewed the registrations. I think many of you will find this very helpful. The CNA is the Center for Naval Analysis, and basically they make recommendations to branches of the military and the federal government. I guess it's an NGO, but what's very interesting, next slide, please, Ariel, is they did a whole report on the impact of extreme weather on older adults. And I'll go and come back, I'll circle back to this a little bit, but the idea is what's different now is communities are facing polycrises. You can read in the bullets, there's so much going on at the same time that really strains resources. In the past, maybe the FEMA or the feds or some donor would come in with a couple of $100 million and be able to handle a disaster. Now we're talking about billion-dollar disasters becoming the new normal. That's very significant. EMAs, emergency medical agencies, have to consider older adults after a response. How do we plan for older adults? And our colleagues are going to talk about this from HICHC later. And also, what do we do? How do we respond to an emergency? Do we know where all the older people are? Do we know where to find them? And then how do we recover their lives? Next slide, please, Ariel. And I'm going to take a commercial break here because I really like to think intergenerational. Ageism is alive and well in the United States. It rips my heart out when I see high school and college kids talk about how annoying old people are, because extreme weather is really an intergenerational issue. And I just want to point out the woman on the left there with the hat is 103 years old. That's me in the middle. I bring these 2 wonderful women in to speak to some of my Harvard medical students, and the woman on the right is 87, and she drives the 103-year-old around. I mean, this is the new normal in the United States. And that's unusual for them to be that independent. Next slide, please, Ariel. And what I love about this is I found in researching this, I read just about everything I get my hands on, and I restricted this mostly to federal resources. And for those of you international participants, there's a rich literature and rich material in different parts of the world, but what I'm presenting here is all US. But this is the Moms Clean Air Force. Now, I'd never heard of this. And what it is, it's 1.5 million moms, I guess how they self-identify, have come together to address issues affecting their families. But they did a whole section on climate change and the health of older adults. I would highly recommend downloading this and hanging it up if in your office or your health center, because though those hidden ageists would be good for them to see that moms have to understand this, because if you have an elder in your community, if you have an elder in your family, it's not the elder's issue, it's the mom's issue, and those are resources that are going to be taken from the children as well. And if you take a look at this list, it's actually quite fascinating. It's a very, very comprehensive list, just about everything you find in the literature. Next slide, please, Ariel. Let's talk about mental health for a minute. Now, this is from the American Public Health Association. The American Psychiatric Association has similar resources. The American Psychological Association has similar resources. But the idea here is that there's a significant number of people in the United States who suffer from mental illness. And after disasters, obviously, people are at increased risks for all kinds of mental health effects. And there's a pretty reliable literature indicating that more than half of adults and almost as many children suffer from depression after a natural disaster. Now, for older adults, we know that depression is it can complicate and exacerbate issues. There's a lot of literature. One of my colleagues did a lot of research after Katrina, and almost half of the survivors developed a mood disorder. And there were increases in suicidal ideation. Now, this is really tragic. In the 1980s, any of you from the Midwest, or others may remember this, but the suicide rate doubled in the upper Midwest after a severe drought. People lost everything. Next slide, please. This is, again, a resource from APHA. It's a fact sheet, something you can download, you can hang on a wall, you can pass around, you can include in the material that you're developing, but I would just direct you to that. And you can see it's in a collaboration with other agencies. Next slide, please, Ariel. So this is very interesting. This comes out of the Global Change Research Program. It's a program that started in 1990 by Congress. And the idea, and there's 15 member federal agencies. But you can download this as a very interesting report, and it'll help some of you in the material that you're trying to develop. But I just want to point out that we're all pretty familiar now with social determinants of health, but we think about climate drivers. If the way to look at this figure is look at the center with the large shaded boxes, darkly shaded boxes, climate drivers to health outcomes. On the left, you see exposures. On the right, you see that people in poor neighborhoods without resources are much more likely to be exposed. People of color are much more likely to be exposed in the United States, in urban areas especially, much more likely to be exposed to the ill effects of climate change. And you go down the next level, it's the sensitivity, and people with chronic medical conditions, typically older people, much more likely to have serious outcomes or impact after a extreme weather event. And then if you look at the adaptive capacity, people who don't have access to healthcare, and this is where we all come in with our organizations, our public health organizations, our health centers, our NGOs, people who don't have access are much more likely to be impacted by these, and it has negative health outcomes. But I would advise you to take a quick look at this report. It's rich with resources. Next slide, please, Ariane. Back to the CNA report. So let's just step back for a minute and think about this. Extreme weather for older adults, it puts an increased demand on resources, and it strains critical sectors like healthcare, emergency services, support services. I mean, it's especially for older adults. I mentioned the poly crises, but think of the challenges this puts on the state, federal, of course, but state resources, local EMA, emerging medical associations, and just on communities at large. Who gets the resource? Do you give it to a family, or do you give it to an older person? I mean, these are things that have to be thought out in advance. This social polarization, some people, in terms of, we talk about changing climate, that can be a political lightning rod. There's a lot of social unrest, political instability. If there's a change in political priorities, Are resources going to be diverted to FEMA? Are resources going to be diverted to NGOs that provide these sorts of services? Will the Global Change Research Program continue to be funded by Congress? Will NASA's space observatories be able to continue? These are things that really, this political instability is something to be thinking about. And really how the national elections are going to affect climate policy, because this has become a political issue. These are things that are being recommended by the CNA. And we're going to continue facing these issues. They're not going to get any better. Next slide, please, Ariel. In the next 2 years, we expect severe global risk to be the top 2 most severe global risks to the world, if you think about it. I mean, are we ready for it? And I think that's why you're all here. The $1 billion I mentioned, new normal, where are these resources going to come from? And as a result, state and local governments, especially local governments, are much more vulnerable and much less prepared. So I applaud those of you who are attending for the purpose of increasing your preparation, as I read in some of the registration. I applaud you for that. And we have to remember that extreme heat is the greatest climate risk to older populations. Next slide, but it's not the only climate risk. You've all heard about the heat index. I just not want to spend a lot of time on this. This is from NOAA, but the way to look at this figure, on the left, you see relative humidity, and on the top, you see temperature. Now, it's not uncommon for many of us where we live to see, just go to the very top line, 40% humidity. And if you get to 90 degrees, which we get to quite frequently now, is caution, but it's extreme caution. But if it goes to 98 degrees, now what's important about this, these are degrees in the shade. So wind and direct sunlight increases the temperature by 15 degrees. So if you move your mind's eye all the way across to the yellow, that's really where the extreme is if people are in the sun. And the red represents extreme danger. And this is why farm workers, for example, are really trying to lobby to protect themselves from extreme heat. You can't be in the sun, even if it's only 100 degrees and you're in the direct sunlight, you're still in extreme danger. So I think it's important, those of you who are planning, to understand when you're hearing the heat index and try to develop a fuller understanding and public service messages around that. Next slide, please. Heat islands. Wow. So, those of you in urban areas, I think this is something that we're going to experience increasingly. It no longer is just heat waves, there are heat islands. And what used to be a heat wave now becomes a very dangerous area where heat remains for days and days and days on end. But I would direct you to this, and there's some mitigation approaches that are mostly long-term, but it's something to be aware of. Next slide, please, Ariel. It's from the EPA. We're moving now into resources. I would direct everyone to the CDC webpage, this webpage on natural disasters and severe weather. Next slide, please, Ariel. What's great about this page is it has very specifics. You can see here right across the top, but the info for specific groups might be something you're interested in. If you're near water, disaster resources, and can you think about evacuation routes? Next slide, please, Ariel. So this is what I like so much about this website is that there are extensive resources in multiple languages. And there's all these little click on or drag down menus down on the left, the different types of disasters. So if there's a tsunami, for example, which we don't experience where I live in Boston on the East Coast, but some people may be exposed to tsunamis, I can click specifically there. Next slide, please, Ariel. And here's an example of a resource for health professionals. This is if you clicked on that box for health professionals, there's, for many of you, I thought about this for the folks when I read the registrations, this for clinicians. How about for communications? That's really important. But just to think about, developing volunteer networks or the health alert networks, these are really great resources. So These are your tax dollars at work. Take advantage of them. Really, I mean, it's a wonderful resource. And I don't have time to go deeper into these, but you keep clicking in and I think you'll find something. Next slide, please, Ariel. It's an interesting delay. Okay, this is really something that I think is important for health centers or health providers. Um, if the state requests services from the Administration for Strategic Preparedness and Response, teams are available to come in. And if you're not aware of this, I would suggest that you take advantage of it. And what's interesting about the ASPR is that if folks need to be medevac, they can medevac people to VAs, Veterans Administration hospitals, or DOD facilities as well. They can bring teams in to assist. Remember one of the risks that CNA talked about was the shortage of providers. Well, here's an opportunity on the federal level to bring in some support for your health centers. So I would advise, if you're not familiar, get familiar and try to lay some groundwork if, God forbid, you need to take advantage of this wonderful service. Next slide, please, Ariel. And of course, everything's got limitations. The HRSA webpage on emergency preparedness, if you take a look at this, next slide, please, Ariel, you'll find that they connect you to other federal resources. And there's FEMA, and then there's the disaster recovery centers, and also for small businesses, which is very important because small businesses are the glue that keep communities together. Next slide, please, Ariel. This is the Aging and Climate Change Clearinghouse. It's based out of Cornell. It's a great resource. For those of you who are, I saw somebody, I don't know if you're here, but was working on a dissertation. If you're not aware of this, you're going to love it. But it has resources for researchers, and I think for most of us in the room today, for organizations. And it's a way to get some state-of-the-art evidence available. It's run by Carl Pilmer up at Cornell. Next slide, please. Ariel, thank you. Now, I want to talk about fires. I have a great deal of experience, unfortunately, in fires. I used to work closely when I was a clinician with a public health social worker with the New York City Fire Department, and a great deal of experience with disasters. And I'm including this maybe out of selfish reasons, but I want to remind everybody about this. According to the U.S. Fire Administration, who collects all these data, people 65 to 74 are more than twice more likely to die in a fire. 75 to 84, 3 times more likely to die in a fire. And unfortunately, these rates are going up. And if you're 85 and over, you have the highest likelihood of dying in a fire. Next slide, please, Ariel. The Maui fires, this horrible event on August 8th. This is the preliminary report from the Maui Police Department. And if you look on the left, there's a remembrance ceremony that our Hawaiian colleagues will know more about than I. But if you look on the right, you will see who died. And who died the most were the people 69 to 79. The way to look at that chart on the right, if the numbers are too small, the highest is ages 69 to 79, 59 deaths. On the right is 80 to 99, 13 deaths, and the left is 40 to 459, 13 deaths, and the left is 18 deaths. You can see the way they're clustered there on age. Now, there's other contributing factors. Maybe there are more older people in the community, but there's no reason for so many people to die in today's world with these sorts of emergencies. What have we learned? What can we take from this to prevent this from happening in the future? Next slide, please, Ariel. Continuing on this theme, extreme weather is why it's been doing this for decades. I love AARP resources, and I have no benefit or affiliation from AARP. I'm just directing you to any of the resources here. But you can see here, these are extreme weather deaths. In the dark shaded areas, we'll start on the left, Hurricane Ian in Florida. You can see 100 people over 65 died. If you move over one to the right, Hurricane Fiona in Puerto Rico, the vast majority of the people who died were over 65. And this is important, bottom left, the big freeze in Texas. We're talking about heat, heat, heat. The cold also kills. The big freeze in Texas. And we can see that the majority of people there also died. And then that horrible campfire in California The majority of people who died were over 65. It's something to think about. Work with your local fire folks. They are always, I find, amenable to understanding this. Do they know where all the older people are in your region, in your neighborhood, in your community? Do we know where the older people are? Most first responders in suburban areas are going out to see old folks. Next slide, please, Ariel. I'm going to wrap up in 4 slides, I think. I would direct you to the AAR resource on disasters. And next slide, please, Ariel. And within that resource, there's a disaster resilience toolkit that I think many of you would find helpful. And a lot of it links to other federal and state resources. Next slide, please. And just to review from the VA, this is what we need to do. And this is what we need to think about. Minimize disruption of health services. Do we have shelters for old people? And do we have checks and balances to know where folks are? And there are systems. Do we triage rapid reconnection with family and providers? And this is really important. Do we have community? Geomapping is a very powerful tool. Do we know where all the older folks are in our community? Next slide, please, Ariel. Again, monitoring. I think we're going to hear a little bit about this. Fostering organizational linkages. And just most of the theme here is to keep people connected. And these financial resources post-disaster are critical. This is where FEMA might come in. Next slide, please, Ariel. And I'm going to close with these 2 slides. This, again, from FEMA in multiple languages, which I always appreciate. Programs to support survivors. Next slide. And there's a drop-down menus on the left. And here's an example of one. There's a federal drop-down, but this is the state. And on the left, it lists every state. And you can click on your state and find local referral lists. Now, these aren't going to be perfect, but it's a start. And with that, I thank you very much. And is there anything that came up in the chat? And I look forward to hearing from our Hawaiian Island Community Health Center colleagues.
Wonderful. Thank you. I think we have just a quick slide next that just says questions. I would love for us to circle back at the end of the hour on something that came up in the Q&A around the increasing number of grandparents who are raising their grandchildren. And I think it's kind of connected to a broader conversation about informal caregiving that can go in a variety of different directions and ages, but something that is, I think, crucial to discuss in the context of truly planning ahead for emergencies. So I think without saying any other pressing questions, I will say feel free to continue to think on it, put things in the chat or the Q&A. But we are very excited. We can go to the next slide. To introduce a team from the Hawaii Island Community Health Center and their Health Equity Department. We're going to learn a little bit now around their work in general, especially their focus on their older patients. And then we'll transition to a discussion a little bit more in depth on emergency preparedness and communication and connection. And we're really looking forward to learning from them. So Leanne, I'll transition to you first, but I would love for all of your team to have a chance to share with the group. Thank you so much.
Thank you so much, Ariel. And before I begin, I would just like to send a special mahalo. Thank you so much to the NCECE, Dr. Peter, Ariel, Tiff, Juliet, for getting us prepared for today and making the connection first and foremost. We appreciate you. Next slide, please. We are excited to share with you all today. We are Hawaiʻi Island Community Health Center. Our mission as a health center is to promote lifelong health and wellness through quality healthcare that is comprehensive, integrated, culturally responsive, and of course, accessible to all. Our mission is very straightforward: a strong, healthy, nurturing community, and our values there of respect, excellence, advocacy, compassion, and humility. Thank you so much, Ariel. Next slide. I'm responsible for the health equity team at Hawaiʻi Island Community Health Center. These are just a few of our colleagues in the department that I'm responsible for. We have a total of 38, maybe now 39 team members. It's basically split into 2 groups. We've got an external team made up of community health workers, community health educators, 2 that you'll hear from today, Kamaile and Frankie. as well as our internal team of patient navigators. We do a lot of focus on connecting our vulnerable populations. Of course, we're highlighting our elders, or as we say in Hawaii, kupuna. We focus on our kupuna. You'll get a chance to hear from Frankie and Kamaile today. Much of our work over the past 2 years is what we'll highlight today. So we appreciate the opportunity to share. In regards to the social determinants of health and much of what Dr. Peter has shared, it's fascinating. Dr. Peter, thank you so much. You've helped us in our own research, so we're going to take much of what you shared back into our work. Next slide, please. Perfect. I want to spend just a little time on this slide. As you can see, for those who are not familiar with Hawaii Island, the Big Island, otherwise known as the Big Island of Hawaii, we are the largest of all 8 Hawaiian islands. You could literally place each island within the Big Island and it still wouldn't max out. We're about 4,028 square miles. You'll notice there the various dots on the map. We just acquired, or another health center merged with us, now making us the largest health center across the state. We have a total of 25 locations because we've expanded into schools. It's a pilot project that we're partnering with the State Department of Education. But if you can see from Waikoloa on the left of the island, wrapping around to Hilo, that's about 2/3 of the island that we are responsible for, especially the community health workers, community health educators, because much of what we do, especially caring for our kupuna, takes place outside of our clinic walls. Nice graph here on the right side. What vulnerable groups do we service at our outreach events? You can see just the percentages and listing. We do outreach to many of our youth, our freely associated states, friends and families from Marshall Islands, Native Hawaiian women, men, kupuna, of course. We do also a lot of outreach to the unsheltered and homeless. Dr. Peter mentioned the migrant farm worker population across the state of our 14 different community health centers. Our health center is the only health center made up characteristically geographically with the populations of our migrant farm workers. We are the only health center that could apply for the HRSA scope to create a migrant health center, and we're looking towards doing that as part of our strategic plan in the future. Fast from Kosrae, freely associated states. So a lot of kupuna coming. Many of us know the Compact of Free Association. There was recently a renewal of the compact between Micronesia. So you've got Republic of Marshall Islands, Republic of Palau, Federated States of Micronesia. Frankie, who you'll hear from later in today's webinar, is Kosraean, from Kosrae, but he's spent about 20 years now in Hawaii. He acts as an anchor, a leader for those coming from Kosrae. Micronesia is about 3,000 miles west of Hawaii. So when they prepare to relocate, migrate from home to Hawaii Island, Frankie is the contact to make sure that everything happens in as much of a seamless manner as it can. And of course, matters of health literacy are often addressed. Next slide, please. I'm going to turn it over to Kamaile Iniguez. She was hired as a community health worker / kupuna advocate. That's actually in her official title, so that elders, the focus on kupuna lives in our program and is a high priority and focus for our outreach efforts. So Kamaile, I'll turn it over to you.
Aloha, good morning. I am Kamaile from Hawaii Island Community Health Center, and with our Healing Na'i program that we created, it's for our kupunas or elderly, which I go and assist them in doing health and wellness checks, which we usually go out and about maybe once a month, maybe twice a month, and we do blood pressure and glucose, making sure we get their health checked. Assisting them with making appointments, specialty appointments. And I also partner up with Office of Aging here, who assists with kupunas that allows us to build a emergency folder and get them prepared for any disaster or anything here. Mahalo.
So I think we're going to have Frankie next. As we wait for Frankie, I'd like to also mention that Hawaii Island has 10 of the 14 climate zones. So, of course, we're talking about preparedness, emergency preparedness for climate change, natural disasters. So it's a very exciting island that we live on. I'm going to turn it over to Frankie, and he's going to highlight, these are snapshots of many of the outreaches that we've done. I think to date, from January 2024, the outreach team has completed a total of 183 outreach events. So that's phenomenal. Frankie, I'll turn it over to you.
Good morning, everybody. Yeah, it's an honor to be here. These slides are just pictures that we take of each outreach that we have, like the ones on the bottom left. It's an outreach event that we had for the elderly population here in Kona, and also reach out to the Micronesian community. The pictures that are showing the kapunas that Dr. Lee is hanging on to from Koshai. We have whole special events here for the community once in a while, and also outreaches that we do at our clinic with Kamaili on the bottom right over here, doing blood pressure checks and all that. And we also do uh, musical outreach to our elderly community, where we take a group of youth that they go out and do sing and all that to the elderly people that which they really enjoy and love, where we reach out to them and go out to their the housings here in within our area. So, and picture in the middle right there, we do outreaches to the migrant farms here. That's one of the pictures that shows that we go reach out to them and just support them with help, where we have our Spanish speaking person that works with us in the community, that we reach out to the coffee farms here on the Big Island. So these are just some photo snapshots of the outreaches that we do here on the island. Thank you for my time.
Thank you so much, Kamaili and Frankie. Lastly, I'll share, in addition to the outreach that we do to Kupuna, we work with the Native Hawaiian homestead lands with the Department of Land. Department of Hawaiian Homelands. Kamaili has established strong relationships with leaders so that we can reach out specifically to Native Hawaiian kupuna that are in need. We do home checks and follow up on any resources. Kamaili is very well known with our street medicine program, outreach to kupuna that are homeless and unsheltered. And we're just so blessed to have built a strong relationship at the state level, county level, and of course with various nonprofits that know of our work. And now we've got a new partnership, friends, Dr. Peter, Ariel, Juliet, and Tiff. We just want to extend a big mahalo from our entire health equity department at Hawaii Island Community Health Center. Mahalo nui for having us.
Thank you so much. I know we have a closing slide here for the content that you can click on the link when you get their slides to look more at their health center in general. But I'm going to have us go to the next slide and just have the team from the Hawaii Island Community Health Center give any reflections. I know it's taking a little time to load. That's okay. That I think so fantastic to have an example of a health center that has such a strong focus on your older patients already. So I know that for some, there's more of a challenge in, thinking about emergency preparedness in general, and then thinking, how are we going to, prioritize this patient population? You all are already prioritizing this patient population, but for some reason, the question is not loading. That's okay. My general question for the team is to give us any additional details around ways that your health center plans ahead for the extreme weather that your island has faced in recent years, and then thinking about the potential for other types of environmental impacts, in addition to that individualized outreach where you're helping folks to have plans developed, in addition to the fantastic connections that you have with various levels of government. Any other reflections you want to share with us on the unique challenges that your island faces environmentally, and the ways that you focused on preparing ahead, keeping the kupuna in mind for that?
Sure, I'll go ahead and answer that, Ariel, and then turn it over to Kamaili or Frankie if they have any other mana'o input to share. We have built strong relationships, as I've mentioned, with many of our organizations across the county, starting with Mayor Mitch Roth and his civil defense. So that's key on our list of who we reach out to stay ahead of what's coming, what's happening. We also work closely with HELCO. That's our utility on island. They often provide us guidance. Myself, Frankie, Kamaili, we serve in various roles outside of our actual work with the health center, which allows us to stay connected, stay informed. Relationships are such a big part of Hawaiian culture. And through those relationships of we've got intergenerational households. And so many generations living under one roof, we can often get the information out to the leader of the household or the home to then share. But I would say it's our connections with our county civil defense office and our utility. I've also got strong partnerships with the telescopes, specifically Keck and Canada France Hawaii telescopes, so we can sense and get a sense of what's happening and what's coming down. I'd like to turn it over to Kamaili and ask her to speak about Maui. She recently had an opportunity to outreach to Maui as a result of the fires. Maybe there's some lessons learned that you can share with us, Kamaili.
Yes. So I went to Lahaina when everything happened. I was one of the fortunates that got to go, and having a medical assistant experience prior to being a community health worker, I got to go out, meet at Department of Health with a couple other colleagues. We flew in for the day, and they designated us to go to one neighborhood, which is the Hawaiian homes that was nearby, and a lot of them had kupunas in there, which I guess we call it the po'o, so the head of that Hawaiian homelands residence area. I got to meet them, and I got to hand out my card, and they reached out to me when I got back to the Big Island to like get more resources because they didn't know where to go and what to do. And through my computer of just researching, helping them research and sending like an email or a text message or just writing a piece of paper and giving it to family members who are here. It assisted them in moving forward and guiding them to like what more needs to be done, where do they go. And then recently, like a week ago, I went to Maui again to go and have a Ohana Day with my partnership of resources. And we ended up doing an Ohana Day where we had all the keiki people who were staying in the hotels nearby got to come to Royal Lahaina and just have like a relaxing day. We did painting, we played games. All the children, it was like a big relief, and parents got to come or they could just hang out at the beach while their children, their kikis, got to play with us and hang out. We got to teach them ukulele, and the parents also enjoyed doing that. We had a parent that just painted the whole 2 hours that she was there. We had another dad learn ukulele. There was like 4 different songs. So it's all about giving back, but at least they knew that we're not just um because we're separated by the ocean, we're not separated by kokua or assisting each other no matter how far the distance is.
Wonderful. Well, I really appreciate that. I know that there's some questions that have been coming through, and I think that Peter's answered some. I did want to ask, and this might be a question for both Leanne and Frankie, but someone had mentioned that this was a new learning moment for them to understand that people are migrating from Micronesia to Hawaii. Do you find that many of them are climate refugees? Just any more context to help us learn a little bit more about that situation and the important work that Frankie does.
Sure. Thank you, Ariel. I'll speak briefly and then turn it over to Frankie to speak more about his community coming over from Koshrai. So back in there was a compact treaty established between the U.S. and Micronesia as a result of the nuclear testings that happened. So migration from Micronesia has been happening since the early 80s. We've got in the state of Hawaii about 18,000 Micronesians representing Marshallese, Republic of Palau, or any of the federated states of Micronesia, which are made of Koshrai, Pohnpei, Yap, and Chuk. And so across the cultural groups I just mentioned, there are about 11 languages. So when it comes to healthcare access, support for social determinant of health, there's many challenges, but we've got leaders like Frankie and others from Marshall Islands and Kiribati that work in the health equity department, which allow us to make great connection. As far as the percentage of those who are migrating due to climate change, I know those from Kiribati and Marshall Islands are making their way over. I don't have an exact number, but we are partners with the current, the re-elected president, Dr. Hilda Heine. I believe she was the first female elected as president 2 terms ago. She's back in presidency now, so we're engaging in conversations with her and the team in terms of identifying the population percentage that are migrating due to climate change. That is a strategic point in our health equity department for this year, to be able to provide more resources and educational workshops around that. In a few weeks, we are offering a training to the Hawaii Police Department on Hawaii County, or in Hawaii County, to all the officers so that they can get educated and just better informed about the migration of Micronesians to Hawaii Island. Such a beautiful culture. I'll turn it over to Frankie.
Yeah, thank you. There has been a large influx of Micronesians especially from Republic of Marshall Islands, because most of those islands are low-lying islands in the Micronesia. And for FSM, there's a lot of more volcanic islands in the FSM, which are from where I'm from Koshai. A lot of our folks used to live by the shorelines in Koshai, but now the government is telling people to stop building houses, shorelines, just move to more higher land. And that's one thing, and it really is affecting the islands. This past 2 months ago, I believe they had the high tides, which a lot of the lower lying land, which overcome with water, which a lot of people had to live in their houses with a lot of water inside their houses. And so what I know the government is telling the people is to stop building houses near the shoreline and to move more uplands to build their houses up in the more higher grounds. But that's what I know about Micronesia. And yes, a lot of people migrating here from Marshall Islands, because of a lot of the islands in Marshall Islands are more low-lying islands, more flatlands. Yeah, thank you.
The last thing I'd like to add, Ariel, is through a grant project, Frankie and I, along with our other colleagues from Marshall Islands, we had a chance to fly to Micronesia. We stopped in Majuro and Koshrai. Frankie and I took a boat, not a fancy boat, just like a boat you'd go to catch crabs on, through a mangrove. One of the health centers in Koshrai in Walong is only accessible by water. So there's a few hundred people that live in Walong municipality that is only accessible by boat. So a lot of concern for families that live in areas where it's only accessible by boat. We're not sure what's going to happen. Frankie's flying to Koshrai in 2 weeks, I believe, Frankie. So he'll be checking on the community there and coming back with reports. Thank you so much.
Thank you. I know that we're just about at time, and I want to let Dr. Maramaldi give us a final reflection as we close out. I do just want to acknowledge the questions or comments that have come in around, again, whether it's grandparents raising their grandchildren, the need for more caregiver support. I think a lot of this ties in with this theme of connection. I think the Hawaii Island folks really have showcased the importance of connection, both in a for staff with patients with each other and families in the community, as well as these connections with these larger groups or government. And I know that more support is needed across the board, especially in certain areas, to include caregivers in these planning conversations, to provide more resources, to connect folks with information early and often. So just want to acknowledge that is a need that will continue and hopefully will improve in the way we involve those important folks. Dr. Miramaldi, can you close us out with any final reflections?
To your question, Ariel, there's a whole literature on foster grandparents. If anybody's interested, you start there with a literature search. Lots of programs, even SSI benefits in the United States being transferred to grandparents if parents are no longer capable of caring for their children. Also, all the multi-generational stuff. I would start with that website that I included. But mostly, I want to thank everybody for this effort. And I think what our colleagues from the Hawaiian Island Community Health Center have demonstrated is the importance of proactive planning ahead, knowing where folks are, and having things in place before things happen. So I thank you so very much, everyone, and to the attendees, and I wish everyone well. And please, please take care of our most precious elders.
Thank you. Yes, we appreciate so much your time today. We so appreciate Dr. Maramaldi's presentation, and for our new friends at the Hawaii Island Community Health Center. We're so impressed by your work and look forward to seeing that as it continues to grow. Thank you all for your participation and sharing. Please do keep in touch with us if there are questions that arise. As you're reflecting on this material, we'd love to hear from you. Please do take a moment to fill out a quick evaluation, and we'll be in touch with you all very soon. Thank you so much. Have a wonderful rest of your day.
Thank you.